Hello and welcome to ImmunoLogic, the show where immune breakthroughs meet clinical logic, turning cutting-edge discoveries into practical, patient-focused interventions. And I'm your host, Dr. Joe Fraietta, and this is our episode 0, a quick introduction before we dive headlong into the year's most compelling topics in immunotherapy. And today, for you, I just wanted to set the stage for what you could really expect in the episodes to come. So we'll explore how new therapies move from bench to bedside, how clinical data translates into real-world decisions, and how regulatory milestones like FDA approvals reshape our expectations for patient care. We'll talk CAR T therapies and TIL-based approaches. We'll dig into gene editing and CRISPR-driven innovations and examine the evolving world of antibody-based treatments, which admittedly I'm learning about too. And that's not all, whether it's long-term safety data or improved manufacturing pipelines or beyond the era of preliminary findings whispered in conference hallways. So at this point, immunotherapy has really reached a stage where durability, safety, and scalability are front and center. But while oncology, remains at the heart of many immunotherapy advances, we're not going to stop there in the show. Increasingly, these tools are being adapted for diseases outside of the sphere of cancer, autoimmunity, chronic infections, and even regenerative medicine applications. So from harnessing immune tolerance in organ transplantation to exploring gene editing for inherited diseases, the possibilities are endless. Reflecting on the past year, we've seen the field test its boundaries. Again, immunotherapies are no longer confined to a handful of high-profile indications. We're branching into solid tumors. But questions remain. Are we still hitting the right targets? Can we scale these therapies so they're not just a boutique option at top-tier centers? Can we make them widely accessible? And can we transform community care that way? So looking ahead, 2025 promises its own brand of excitement. Think East Coast versus West Coast gene editing rivalries, but friendly competitions that really spark innovation rather than division, and an intensifying push to make cell therapies as commonplace and standardized as any other frontline treatment. And we'll see as new approvals emerge, what was niche last year could really be the backbone of tomorrow's standard of care. So that evolution just, again, isn't about oncology. Again, it's about reimagining how we modulate the immune system to tackle a broad range of health challenges. In upcoming episodes, we'll have a lineup of guests who are shaping this landscape. So clinicians testing these therapies in real-world settings, researchers like me tinkering at the genetic level to refine targets, and even regulatory experts who understand the policy levers that can either expedite or hinder progress, as well as industry leaders, who really know how to translate breakthrough data into sustainable treatment models. And because I'm a PhD scientist, admittedly, rather than a practicing physician, that's right, not that kind of doctor, at the moment I'm searching for a co-host, someone who can really help ground our discussions in the everyday realities of patient care, which I can't help with unless we're talking about mice. So consider it a talent search rather than a co-host draft, I guess we could say. Although I might need to sharpen my negotiation skills if I'm going to snag the right person. In any case, the point is that our conversations will be grounded and data-driven, but we'll also keep them accessible. So if you're not, if you're a clinician, a translational researcher, or part of the biotech ecosystem turning raw discovery into tangible therapies, you'll find value here. And if you're a patient or advocate tuning in, know that while we'll be speaking the language of science, clinical practice, and regulatory nuance, your perspective matters. So we'll kick off the new year with deep dives into scaling up cell therapies, exploring fresh gene editing approaches, and evaluating strategies to ensure these breakthroughs don't just really stay in academic labs or at big centers. Remember, the promise of immunotherapy is global, and its impact should be felt by as many patients as possible, whether they're facing cancer, an autoimmune disorder, or a chronic infectious disease. So consider this your warm-up lap. In a few weeks, we'll be back with our first full episode, guests in tow, ready to tackle the immunotherapy frontier with rigor and insight. Until then, keep asking questions, keep challenging assumptions, and prepare for a podcast that respects your expertise and shares your passion for turning science into solutions. Again, I'm your host, Dr. Joe Fraietta, and this is ImmunoLogic. Thanks for listening, and I'll see you all soon.